Britain today confirmed 12,718 new coronavirus cases and 738 deaths amid signs that the country's outbreak may have stopped shrinking, with a symptom-tracking study suggesting infections are now rising in parts of the UK. The ZOE and King's College app suggests the number of people reporting symptoms of COVID has started rising again in Scotland and Northern Ireland, as well as Yorkshire, the North East and the East Midlands in England.
Scientists behind the surveillance study said infections are starting to trend up again and called it a hitch, given that almost every other key metric shows that Britain's second wave of infections is firmly in retreat.
Official Department of Health data, which shows confirmed infections and not just people who have symptoms, shows infections have been falling for around 6 weeks. But today's figure is only a tiny drop, 2.3%, on the 13,013 last Wednesday. Deaths are continuing to drop, however, with a week-on-week fall of 26%. Any turn in the trend could be devastating now, with the government inching closer to finally lifting lockdown for good. But doctors and scientists say they want infection and hospital numbers as close to zero as possible before draconian restrictions end.
Boris Johnson today suggested pubs, bars and restaurants will be the final parts of the economy allowed to fully reopen under his lockdown exit strategy, which he will unveil on Monday. The Prime Minister said his blueprint will be based firmly on a cautious and prudent approach to ease restrictions in such a way as to be irreversible. It is thought the document will not allow the hospitality sector to get back to normal until July, a prospect which immediately sparked Conservative anger.
The PM is under growing pressure from backbench to scrap curbs as quickly as possible, with data showing the outbreak is shrinking and the vaccine rollout continuing to be a success. Almost 16 million of the most vulnerable have already had their first dose, with another 380,000 jabs dished out yesterday.
Figures collated by the King's College London surveillance study show the biggest increase was seen in Scotland, where the daily number of symptomatic cases has risen to 28.5 per 100,000 people on February 13, up from 25.2 the week before. Infection rates have also risen in Yorkshire and the Humber, 19.8 to 22.0, the North East, 25.7 to 28.2, the East Midlands, 22.0 to 23.8, and Northern Ireland, 28.6 to 30.9. COVID outbreaks also appear to have stagnated in Wales, the West Midlands, the North West and the South East. The COVID symptom-tracking study, which is the first surveillance project to flag that the outbreak has started to stagnate, estimates infections based on the number of people reporting symptoms linked to coronavirus and less so on actual positive tests.
Professor Tim Spector, an epidemiologist at King's and lead scientist behind the study, said his team were looking into whether the increase in symptoms was down to people having mild reactions to their jabs. He said another plausible theory was vaccinated people taking more risks, or an increase in close contacts as a result of millions of Brits traveling to vaccine centers to get their jabs.
This data is from the Department of Health and compares the change in the infection rate per 100,000 people from February 11, the latest date available, to a week earlier.
Area:
Torrich,
Exeter,
East Ayrshire,
Lincoln,
Copeland,
Powys.